what happens if the root canal fails. Okay, if the root canal fails and the retreat fails, then we take the tooth out and the patient is symptomatic. Then we excavate manually, scrape out all the ligament. Then we ozonate 3 times. We do ozonate, then bubbles up, kills all the bacteria. Then we fill it with bone graft and membrane, wait, and implant it 6 months later. I'm looking for good looking blood. Root canal tooth we took out. Okay, failed root canal tooth. Here is the filling of the root canal, and follow it. That's the abscess growing in the bone. So we took the tooth out. We had to cut the tooth in half, and 1 root at that abscess. Now we have to excavate and clean the ligaments and ozonate and disinfect the area. Where is the spoon? The infection continues in the bone. We have to take all the infected thing out. Okay, some people they wonder how come we cannot put implant. Sometimes you put implant after the extraction. In this case, we cannot because there's so much infection. So we have to clean up the infection first, excavate manually, see? And I have to hear that sound of like this, you know, scraping off of the bone to make sure I've gotten to good clean bone. This is all because we want clean blood to fill in with the bone graft. See, still I have. This was the hole. I have to clean the ligaments, make sure we have good, no soft ligament, no soft bone. Okay, I have some still left here. So now we have manually excavated, then we are, we let that be there. See? We clean it manually really good, until I tooth out, Dr. Renee. I took the tooth out. We excavated. Then Dr. Renee, we put a membrane. Then I slammed the tap. So we put the membrane in place. We condensed it with bone graft because we want dense bone. And now, look at it, how beautiful it looks. It's just here. It's just gorgeous. Took the tooth out, yay, and got the infection out, yay, we got it. And put a bone graft, then I use Geistlich bone graft, BioOs. And then we put membrane, I use BioGuide, in this case FibroGuide, because we want keratinized tissue in there. Then we tacked it with salvin tack, and we're gonna suture it.